Hello, my lovelies. I had so many people comment on my last post about how I helped myself out of neck pain that I thought you might want to know exactly what I did, because that's what I was asked. Show me what you did, tell me what you did, show all the secrets. So I started off with assessing all the parts of my body that are connected to my neck to see where the pain was coming from. So I did start with my jaw. Now I'm a tooth grinder. I squeeze my teeth together at night and grind them together. So I have lots of jaw pain or TMJ dysfunction. So I do always start with checking out how my masseters feel, my jaw muscles. So what I do is I put my fingers right at the bottom corner here on one side, and I let the fingers slide up towards my cheekbone and feel how it's getting on there. Is it tender? Do I have a little bit? I have a little bit there that's really tight, and I'm just going to press it, wiggle it, assess it. Can I get it to relieve that bit of tension? And I'll change to the other side. Slide those fingers up. If your fingers don't feel like you want to press them in, use your knuckles. Just move those fingers or the knuckles up. Use your fingers if you want to press right by your teeth and see if that's tight too. So these muscles affect the base of your skull here, the top of your neck, and can cause headaches, tension, lots of neck spasms might originate from here. So that's why we're assessing this. So this was the first bit that I assessed. Left side, so much tighter. I clearly eat my food on the left side more than the right. So that was my first assessment. My second assessment is hair pulling, which might sound really quite strange, but I do like to get my hands into the bottom part of my skull here, make fists with my hair and pull the hair upwards and outwards. And this way I'm moving the fascia and the skin on my scalp, and I'm just moving in little circles, and then I change where my hands are, move them up. And this can be so relieving for headaches, brain fog, eye strain. But this doesn't seem to be what's causing my neck pain right now. So I'm just trying to go all the way around. Can you see a little movement of the scalp there? It's tighter on the top than at the base of my neck. So next one is I check these muscles out in front here, the sternocleidomastoid muscles. And so what I like to do is, you can see where they attach here on the collarbone. If I press my forehead into my hand, they stick out when I push my head forward. And I'm going to grab one and I'm going to wriggle it through my fingers. Wriggle it and move all the way up to behind my jaw. Oh, very tight today. So all the way up as far as you can. And I like to think of these as, the ropes that they have on boats. And often if they're underneath the water for quite a while, they have seaweed or lichen growing on them. And you can feel when you pick this up, if this is the rope for the boat, you can feel the seaweedy tensions behind all the fascia and the ligaments that join that muscle into the rest of your neck. I like to separate them, weed them out, and I move on to the other side. My left side is definitely the side that's tightest. So I'm just moving up and relieving any tension, but this is more of a test. What is tight? What can you feel? So yeah, that's tight. Left side again, left masseter, left SVM, left side of the top of my head on my scalp. So then I'm going to assess my shoulders, and I'm just going to rub them. Really simple, no particular technique. I'm going to go, is the tissue moving at the base of my neck, the top of my shoulder, or not? So the right side, it moves. I can feel some lumps and bumps. I can feel it's a bit tight, but the left one is super tight, and that is definitely where the neck tension is coming from, right at the top, right in here. So levator scapula. So what I did in the video is I used massage gun, any type of massage gun. This one in particular is very cheap. It was about £50. They all do the same thing. You're using vibrational technology. You are shaking the muscle. So shaking the muscle firstly warms it up. Blood flow comes into the muscle. Blood flow means that you have pain relief. You have lots of nutrients in the blood that are coming into that muscle. Helps with pain. So I'm just going to put this on, and generally I would go around the area first, not directly on it. Go around it really gently, and I always use the round, soft sponge head, not any of the other tools because it's too much. And I would just move it all the way around, stimulating for a couple of minutes. Remember, blood flow equals pain relieving benefits. And then a couple of minutes up, stop, and I try to move that muscle. So what does this muscle do, the levator scapula? It lifts my shoulder up towards my ear, and then when I stretch the muscle, it drops my shoulder away from my ear. So I'm going to move that muscle. So talking through what we've done, we've assessed. Is it the jaw that's tight? Is it the sternocleidomastoid that's tight? Is it the scalp that's tight that's causing your neck pain and neck spasm? I worked out on me, it's the levator scapula, the back of the shoulder, the top of the shoulder joint. So I've stimulated it with a massage gun, and now I'm moving it. And then I will get into stretching it. So the levator scapula, to stretch, you do want to tilt your head away. So this side is the one that I'm stretching. So I'm going to put my hand on my shoulder, tilt the head away. I'm going to turn my nose down towards my opposite armpit as if I'm smelling my armpit. And I would take a couple of really lovely deep breaths here. Extended exhales, calming the nervous system. Nasal breathing is best, but my nose is a little blocked today. Lots of pollen. Really calming it down. And then to come out of it, rather than lifting my head straight up, because that's the place that's tight and painful, I would let go of both hands, drop my hands down to my waist, roll my head all the way into centre, chin to chest, and come up through the centre. And that is how I assess myself and how I treat myself. And that's how you can assess and treat yourself and get yourself out of neck pain. It's a super simple way of doing it. There are so many options, there are so many assessments, there's so many different techniques. I didn't even really include massage in there, despite that being my specialty. So what did you do for yourself? What did you find came up for you? Was it your jaw? Was it your scalp? Was it the front of your throat? Was it the back of your shoulder that was causing your pain? Let me know in the comments, and ask me if you want any more detail. If you want me to show you how I treat other parts of my body, just ask. Bye.